One of the question was, because there are some questions about ADHD here, because we talked about autism, we talked about Down syndrome, some questions about ADHD and about a child with ADHD being hyperactive, running around, hitting other children, and a child with ADHD who has been started on medicine, how should we monitor the child? And so some question about ADHD and hyperactivity and behavior. So let's just briefly think about that. So ADHD is basically when children have difficulty in paying attention to things, yeah, focusing on things, but at the same time they are impulsive. So that's not just the only problem. They are impulsive. They can't wait. They would act without thinking. Yeah. And sometimes I wonder, everybody here has ADHD because the number of people cross the traffic lights after it's gone red, you know, or they can't stop once it's gone red. Yeah, so there's a kind of impulsivity to, yeah. I feel sometimes you just, it's orange is turning red, you go. You go, where am I going? Why am I rushing? I can't give a good reason why am I rushing. Yeah, I'm still rushing. Yeah, that kind of rushing thing and being impulsive about things. And the third thing is just being physically very active. Yeah, so just that goes from being very fidgety, you know, dropping things constantly, pen dropping, this thing dropping out of my pocket, this thing there. These people are constantly opening and folding their papers and opening it again, and everybody around them is getting annoyed about the crinkliness. In the cinema hall, they're kind of scratching, folding, opening their popcorns, and everybody's looking at them. Yeah? So there's kind of fidgetiness about them. There's a noise about them. They're talking too much, they're making too much noise. Yeah? So there's a fidgetiness about it. Some are actually hyperactive, meaning they are basically running around, jumping, climbing. Yeah? More so little children than older people. As children with ADHD get older, they become more fidgety people, you know, who are constantly adjusting their seat, yeah, that another, and then this, and then taking something off and putting it back again. And so they are more fidgety people as they get older. So these three things are there. Did you hear something in there about bad behavior? Did I say? Oh, no, it wasn't there, was it? In those three things. No. And do you see bad behavior in every child? I see. Yeah. Including my own children, I see bad behavior in every child. Yeah. So the message seems to be that ADHD is not about bad behavior. ADHD is about attention, impulsivity and hyperactivity, which makes it easier for them to do wrong things. Yeah. Okay, I accept that. Yeah. Which makes it harder for them to think before they act. Yeah. And okay, it might make them hit somebody because they haven't really thought about it. If I hit that child, they'll hit me back, you know. Yeah. Or yeah. Or yeah. So maybe there is a little bit about impulsivity there, but only a little bit. So you work on improving children's attention by having small periods of time. I'm talking about all children. You improve attention by having small periods of time when they can do things with you or by themselves without other interference, yeah, of television, this, that, mobile phone, friends, other children. So that means you have to have some bit of time with your child where you're not going to be interrupted. Yeah, you can have 2, 3, 4 of such times. Yeah, and one activity that really helps attention for everybody is reading. Reading. Yeah. And if you ask me, sometimes people say, okay, listening all this and reading all this, where have I come to? What all things parents should do? I think when children are baby, you know, My mother used to massage my daughter when she was little. Massaging seemed to be disappearing. It's a very good thing. Complete sensory stimulation of the whole body to the child. Mother-child interaction when you're massaging. Yeah? You don't just massage like in massage parlor or something. Yeah? It's different when you're massaging a baby. You're talking, interacting, enjoying, smiling. Yeah?
Singing.
Playing, singing. Yeah? A lot of things going on. So massage is just a word for that, the activity. So doing that kind of activity when they're little, playing with them when they're a bit older, yeah? And then talking with them, but along the route, almost from 3-4 months onwards, choosing the right book. First just with pictures, then with words, then with stories, yeah? As they're getting older. Not forcing them to read, not taking a class, but enjoying the story with them. It helps their attention, it helps their language, it helps their social understanding. There's so many benefits of reading and just reading. But reading not in a way that teachers read. Yeah? So as a parent, you can be like lots of things. You can be like your therapist, like your mother or your grandmother. Just don't try to be like one thing, which is a teacher. Leave the teacher at the school. Yeah? It's a very hard thing. Particularly in India, I see parents acting like teachers all the time. They think that's their new job once they become a parent. No, teachers are appointed in the schools. That's their job, to teach the child. Yeah, your job may be. They?
Do their job. You have to do that.
Maybe. I accept that. And lots of children are not getting on school, and the parents have to do. But generally, I'm saying, the child is meant to have fun with you. Yeah? The child is meant to relate with you emotionally, yeah? At affective level, yeah? And learn from you there, and learn some values, have some fun, have some ideas about doing things. And I think reading with fun. So it's not just reading; it's reading with fun. Not like a teacher in bracket is the thing to do with the children. So that improves attention. I think behavior is what you know about behavior. I'm going to because managing behavior is a very hard thing to do. But you are understanding the situation, why the child does it. And then you are creating a better situation. So you are creating a conditioning in the child. You are creating a conditioning that if in this situation you do like this, you get a star. And when you get 10 stars, you get a gold star. And when you get 10 gold stars, you get a diamond star. Yeah? And when you get 10 diamond stars, then you become my parent. Yeah? I don't know. But I'm saying don't put money on everything, like I'll buy you a new toy or I'll buy you a burger or something. No, I think that's bribing. Yeah? Leave that for grown-ups. So, don't do it with children. Yeah?
Regarding the writing skill, when do we start? Is it a time or whenever he interested like that?
I think as early as you want to do. Children begin to hold a crayon or a pencil and begin to draw and sketch early on, and they begin to copy shapes. By the time they're like about 3-year-old, they can copy a circle or something. They can begin letters and things like that. Yeah. So by 4 or 5, they're definitely there to practice the writing skill.
Because of sensory issue, my son used to eat that crayons and I stopped giving it to him. Now he doesn't know, he doesn't want to hold this crayons itself. Anything to give him to write or writing time in this way.
So what is this? Is about the size of thickness, or it's about
crayon?
Yeah.
Texture.
He eats it.
He's eating, putting in the mouth and grabbing
Okay.
it, biting and all.
What about giving something else instead of crayon?
I could not give anything after that because crayons will not digest in the body. I'm literally scared now. If I because of the chewing sensely, he eats that also, but he throws that, but still I don't know whether sometimes it will go inside. No, I am literally scared whether to give him or not now.
that reminds me, I don't know what happened to पहले स्लेट बत्ती आती थी ना, मैंने कम से कम 10 किलो बत्ती तो खाए होंगे. They all used to eat those battis. The naked, there was a taste to it, kind of. That is gone. That battis are probably gone. Just slate and batti to practice writing. And
still available in markets.
Can you still buy?
My children,
They use batti.
We get even slate pencil also we get, and then he used to eat. That's the reason I'm literally more conscious about, because if something other happens again, this is the problem. Again, something other also arises. That's the main my worry. That's only.
You make a system. If one thing, batti or something lasts, you accept he's going to eat some of it. If he can make it last for 1 day, he gets this. If he can make it last for 2 days, then he gets this reward. Then he gets to eat something which looks like. Maybe make it last should become the focus, rather than trying to stop him from eating, stopping from eating. You have to create some kind of, think of how do you create motivation, maybe thinking it the other way around, maybe that might work, something like that. So I think about we were just wrapping up this ADHD and behavior thing, that behaviors need management by thinking of a strategy about reward strategy. Reward is the biggest word in managing behavior, not punishment. Discipline is the most overrated thing. Yeah? I don't know who started it. I think it was teachers. Because they had to deal with 30 students sitting in front of me. The discipline was their main thing. And then it infected our parents, discipline, and they started applying discipline. It's the most overrated thing really for children. I think the thing that matters is reward for children, and things that matter with children is affection. Let me say the third thing, which is firmness and structure. Firmness, not horribleness, not anger. Firmness makes children relax. They know the boundaries. You have set the boundary. You have set from this time to this time you can do this. There is a boundary to it. You can then negotiate a little bit here and there. They will learn negotiating skills as well. They'll be very handy for their life. But you have to have some boundary to come to negotiation. And you can negotiate something, they'll have to barter something for get something else. You can negotiate something. So it's about reward. Behavior management is about reward. It's about affection. And what we were saying earlier, it's about actually liking the state of your child. Doesn't matter what the state is, and giving that message. And but these are the things. I think punishment is it does. I'm not saying there is never any scope for punishment. Punishment doesn't have to be beating. Beating is just completely doesn't work, and it teaches the child to beat you or beat other children. That's what it does. There is nothing else happening with beating. You are working on the fear principle when you are beating a child. You are creating a fear. And fears are short lasting. Fears don't last that long in children's head. And they overcome their fear. They have learned the art of beating, and you are in the worst possible space then. They completely. So don't go there. It doesn't work. And so fear is not a great way of working with children. I think sometimes anger is a normal expression, and there are times when you can, if they are putting themselves or others at risk, they are going to do something that really they should not do. one does get angry, and you should show your anger then. Yeah, that's really not right what you've done there. But those situations should be few, very few. And you need to think, I'll get angry if he hits others. Yeah, simple things. Yeah, those rules should be very few. I will get angry if he harms this or does this, which is, yeah. But I will not get angry if he stands on the chair or climbs a dining table. I'll stop him from that, but I will not get angry about it. So come on, save yourself as well. Yeah, if you think about it in your mind and consciously say, I have a genuine reason to get angry with him if he does these 3 things, and you give that message clearly to your.
Getting angry also. In my son is, while going to the school, and there is a small shop is there. There are chocolates and all. He knows that the chocolates are there and all. We never used to buy there and then come. While going walk or something, sometimes he observed that this is the shop is there. In near my colony itself, there is no shop. But we have to cross the park and go to the school. We have to cross that even shop also. He literally jumped my gate from individual house. He literally jumped from the gate and he went nicely walking on it, not running anything. I told my husband where he is going, just go and observe where he is going directly. But he previously, I'm scared whether vehicles comes, maybe something happens to him. But he doesn't know anything about. But literally nicely he is crossing the road, everything, and park also he crossed and went and stood in front of the shop for the chocolate. Now whether I have to beat him or how to change him his habit, it's became 3 times now. But how to do, what to do, I don't know now. If my husband is not there, how I cannot manage. Sometimes it will.
Yeah. Okay. So that's a situation where the child is putting his life at risk by crossing the road. You can openly declare clearly, if I'm very angry that you crossed this road. Very angry with you. And you will not cross that road again. And because you crossed that road, you're not going to be playing with that game for today. Very clear message, and then that's it.
I made even shop where I also told him not to come without money.
But
also we don't give. I told him to explain him also instead of.
So the expression of anger needs to be very clear, precise about that thing, and then you need to get over it. Yeah. There is no point saying next day, agle din, next day you're saying, yesterday I was very angry with you. And the child is going, what are they talking about? Yeah? That's the worst thing people do. Yeah? So yes, there is place for expression of anger, very clear expression about some situations, but in a certain way and not beyond that way. Yeah? And so save your own life and for your child's life. So that's just about the behavior and about ADHD. I think we are coming up to winding it up, and thank you very much.
Thank you so much for this session. It's really informative. My child is around with my husband. So
that's all right. Okay. Thank you for coming. Thank you.
My question is, which therapist to see when?
Okay. Last question. Third one. That was the first question. See, who should see when? That's which type of professional should see when?
My husband is a doctor, so he is kind of confused, and he's like putting a lot of pressure on me to go see this person, that person, and like I'm at loss as where to go and
Yeah,
I don't want any unwanted therapies and everything for the child. I mean, my child is 6 and mildly autistic.
I think that's a very good question, because a lot of parents are in this situation. It's like a maze. They're going around and around and around, and they are struggling with that. And what I advise parents to think about what the help you need. Yeah? There is no professional who is going to answer all your questions. Yeah? Except me. I'm just joking there. It's just because I've been answering all different kind of questions. Yeah? But there is no one, nobody, including me. I don't know what speech therapists, they are the experts in what they do. So there is no one person who's going to know everything. That's true. So you think about whether your concern is about your child's health related thing, yeah? And that could be about some neurological problem that needing treatment with medicine or and then it's going to be a doctor, that. Then out of the doctor you say it's about the health or it's about the epilepsy, then it's going to be a neurologist or So you think about the type of problem, You think it's about language, help with speech or language, then it is going to be a speech and language therapist. Then really no point coming to me or a pediatrician or a developmental pediatrician even, You have to go to speech therapist.
Managing autism.
Say again?
Managing autism behaviors.
Yeah, I think managing behavior is here. They are called by two names I have come across here. Or there could be three type of people. One is counselors, help here with behavior. Clinical psychologists help with the behavior, and there are some good special educators who also help with behavior. So I have come across these three groups of people. But maybe it's worth asking, phone them and say, this is the type of problem. Can you help in that? Or do you have expertise in this? Simple, straight question. People should be able to say honestly, hand on their heart, that whether I can help or So I think before you go, you say, I have this type of problem, and I know nobody knows everything. I want to know whether you can help or do I need to go to this? Just that. You can phone and check and ask and then go. But clarify in your own mind what is the type of problem, what's the type of need. If it's a physical type of problem, it's a movement type of problem, then maybe then it may be a physiotherapist is the person who's going to help. If it's a problem to do improving daily life skills or coordination of movements or sensory issues, then maybe occupational therapist is the person. But it is worth asking honest questions. Do you have experience of working with children with this type of problem? And they should be able.
Yes, nobody will say I am not experienced, and not everybody says I am experienced. I have so many
sessions only you come to know the original
status
of the instructor as well as the
child also. But again, because of that, we are passing the time also.
We just go bump into people like with different.
You filter, you find the right person eventually. I know. It's nice.
I have a doubt. I mean, question, not doubt necessarily. Yeah, most of us are mothers, so they'll agree with me. See, from morning to evening, we'll set some firm things for the child, and child will say according to us. Okay, as soon as father enters, it will be a completely different child. I mean, see, typically my child, I'm telling you, from morning till evening, he'll be like very calm, obedient, like that. I mean, he has some issues, that is different. But as soon as father comes, then he starts banging his head. And father will say, oh, no, don't bang your head. Then again, he will start banging his head. Then again, he will interfere. So these sort of things, how to deal with these things? Like I keep telling my husband, see, you're reinforcing this behavior, please stop. But then again he says, see, he's banging his head, if something happens, then what should we do? So fathers have their own fears, I agree with that, but how to handle these type of situations? Because this is like happening almost daily in my place.
Yeah.
And most of the kids, they are like that, as soon as they see fathers.
Yeah. I think one thing we know that all children, and more so children who have got any difficulty, behave differently in different situations. Yeah? We know that. So children don't behave in the same way in every situation. And you have to maybe discuss it in that way, that when the situation is like this, then why is it, what makes the difference? what makes that situation different from when the father comes around and he starts doing something, is maybe the child gets too excited or wants certain kind of attention from the father, yeah, that he doesn't get, yeah, or the father maybe lets the child get away with everything, yeah, and so something is happening there that's making a situation different from this to that, and you have to think about what changes there, why, what is changing, yeah, is he really needing, and then I know you know best how to deal with your husband. I'm not going to go there. What I'll say is that then discussing this is what's changing situation, and if you did it like this, let's see if that changes it. Yeah, make it more result oriented rather than putting the focus on him. Make it more situation and result oriented. Yeah, ये सब तुम्हारी वजह से हो रहा है. That doesn't take you anywhere. So, is that, I'm not sure if that helps, but I think thinking about situations is the way. I know. So I think thinking about situations, what is changing, and suggesting to the father, if we did it like this after you come, and then we see if that makes a difference. Motivate him, reward him. Remember the word reward. It works on everybody. Yeah? So reward him, and I think we'll end here at that point.
That's for kids with the spouse only below 13 years. When the kid is teen, it is totally different. It doesn't work with anyone.
Doesn't work with anyone. Okay, all right. Thank you very much. Thank you. Thank you.
Thank you so much.
Thank you. Thank you. Thank you.